The flu season is more dangerous than ever, and the reason is clear. Declining vaccination rates are putting children at risk. Christine Ware's voice trembles as she talks about the upcoming flu season, her anxiety palpable. "We're trying to navigate what life should look like without being in a bubble," she says, highlighting the uncertainty and fear gripping families. Ware's 4-year-old son Beckett is still recovering from a severe flu infection he contracted in January. Within days of becoming ill, he became lethargic, unable to move his head or arms, and lost the ability to eat or speak. This was the second time Beckett had developed acute necrotizing encephalopathy, ANE, a rare and severe brain inflammation linked to the flu. While the first episode occurred before he received his annual flu shot, the second diagnosis came after he got vaccinated. However, experts now suggest that vaccines may not be as effective for children who have already experienced flu-related brain damage. This year, doctors are noticing a troubling trend: a rise in pediatric cases of ANE and other flu-induced brain inflammations. According to new CDC data, 109 children were diagnosed with influenza-associated encephalopathy, IAE, during the 2024-25 flu season, a record high. Of those diagnosed, 84% had not received their flu shot. This comes as the nation recorded 280 pediatric flu deaths last year, the deadliest since the 2009-10 H1N1 pandemic. But here's where it gets controversial. Some argue that the flu vaccine isn't a perfect solution. While it doesn't always prevent infection, it significantly reduces the risk of severe complications. Dr. Buddy Creech, a pediatric infectious disease specialist, explains, "It's a misnomer to think only sickly kids get hurt by the flu. Vaccination is the best way to protect everyone, especially those at higher risk." Yet, despite its importance, childhood flu vaccination rates are falling. Last year, only 49.2% of kids got their shots, down from 62.4% in 2019-2020. The problem isn't just about hesitancy. Many families face barriers like limited access to healthcare or understaffed clinics. A lot of practices can't offer flu clinics after hours or on weekends, says Dr. Sean O'Leary, an infectious diseases expert. That's a real challenge for parents trying to keep their kids safe. And this is the part most people miss. Even if your child doesn't seem sick, the flu can cause catastrophic complications. For example, 74% of IAE patients were hospitalized, 54% required ventilators, and 19% died. 1 in 5 children with flu-related brain inflammation were previously healthy. So what's the solution? Dr. Molly Wilson Murphy, a pediatric neurologist and CDC author of the study, says, "We don't know for sure if this is a real increase, but I've seen it firsthand. It's alarming. The truth is, the flu is a silent killer. But there's a simple fix: get vaccinated." As Dr. O'Leary puts it, the best way to protect yourself and your family is for everyone to get vaccinated. It's the simplest, most effective way to save lives. Now, I leave you with a question. Do you think the benefits of vaccination outweigh the risks? Or is it time to rethink our approach to flu prevention? Let's hear your thoughts in the comments.